Thank you, Mr. Chairman. I yield now 3 minutes to a member of our Energy and Commerce Committee, Dr. Schrier, the gentlewoman from Washington State.
The gentlewoman is recognized.
Thank you, Mr. Ranking Member. Thank you, Mr. Speaker. Our healthcare workforce is stretched to capacity after having spent now 3 years on the front lines of the pandemic, and add to that recent spikes in RSV and flu. Our hospitals have been overpacked with a shortage of available beds and a real worry, and sometimes a reality, that there won't be room in a hospital if we get sick or injured. And due to stress and burnout, hospitals across the country are experiencing staff shortages. What healthcare workers and hospital workers really don't need right now is more stress on an already stressed system. And that's exactly what this bill will do. As we all know, and as I can tell you as a pediatrician, people who are not vaccinated have a significantly higher risk of being hospitalized if they contract COVID. So why in the world would we invite people from around the world to come visit the United States without that protection, and then put our hospital systems at further risk of overcrowding and collapse? Not to mention the higher risk of getting and spreading the disease around our country, or even potentially bringing new variants to our shores. Vaccination is safe. I speak as a doctor. It is effective about keeping people out of hospitals and curbing transmission. And we should rightly expect that those traveling to the United States get immunized, because we should not risk further stressing an already strained healthcare system. You know, it was only a few months ago when hospitals in my state, in Washington State, were full, and patients with life-threatening illnesses, bleeds, life-threatening injuries had to be flown to distant cities to get care. And whatever we can do to prevent that from happening again, we should do. And making sure we get vaccinated and insisting that those visiting our country get vaccinated helps do just that. Public health decisions should be made by doctors and public health professionals based on data, not by members of Congress for political expediency. This bill is a political stunt. It has no basis in science. It fails to recognize the reality that our hospitals are facing right now, and that any one of us might face if a loved one needs a hospital bed and that bed is not available. I ask unanimous consent to add the text of this amendment to the record. Please leave public health decisions to public health professionals. I yield back.
The insertion